Life expectancy of the elderly and their needs must be estimated on their age and health status. Impact of other conditions like aging process, syndromes related to aging, and other illnesses or chronic conditions or patient care must be noted. Goals of patient care must be set by all healthcare providers. Research has shown that if the needs of the elderly people are not met, they have increased discomfort, dehydration, weight loss, falls, burns, psychological distress, as well as elevated care stress. According to a study done by Harrison, Lowe, Barnett, Grisham, and Brody using the Community Care for the Elderly Needs and Services Use Study, also known as Census, the most uncommon needs that were unmet were hearing, pain, skin care, breathing, difficulty obtaining medications, weight, eating, transportation, cooking, socializing, and pursuit of personal interest. It had also been found that the elderly have increased hospital admissions, increases their likelihood to be admitted to a nursing home, and death. Elderly who have been hospitalized in the last year are considered frail and are prone to continue to deteriorate and poorer health outcomes if their needs are not addressed in a timely manner. I quote, cognitive dysfunction, sarcopenia, impaired mobility, dependency in activities of daily living, multimorbidity, and polypharmacy are core elements of frailty. This is said by Ness, Griswold, Hammer, Strand, and Weiler. This group will benefit for in-home based health care or home health to address their health needs and implement the adequate rehabilitation measures to prevent further decline of the individual's health and improve their quality of life. The major health conditions affecting our population, the elderly population, are chronic conditions like hypertension, diabetes, mental distress, which includes loneliness and anxiety, and bone health, including pain. Bott et al. Found that poverty was a major barrier in accessing nutrition, foods, and medicines, and they could recommend an increase in pension amounts to assist the elderly with their financial situation. They also found that some of the elderly have been neglected and abused. It is thought that the cause for these cases are due to limited household resources and changing cultural values, which have left these individuals abandoned to rely on their own savings. Along with the elderly being financially strained from being abandoned, they may also suffer from loneliness and anxiousness due to their situation. One of the reasons the elderly felt they were neglected, were angry, frustrated, and even desperate was due to their receding authority in the household. Increasing awareness of health facility as well as chronic disease management and lifestyle modification classes will help the individuals in these situations. The elderly have been found to have high out-of-pocket expenses, which can also cause a financial burden. This has also been linked to reduced use of medical services, poor adherence to medication therapies, and are associated with poorer health outcomes. Their out-of-pocket expenses include purchasing medical goods and services, which include copays, co-insurance, deductibles, and costs and services not covered by their health carrier. These costs are even higher for the individuals who are uninsured. 18.2% of 65 to 74-year-olds and 23.2% of 75-year-olds and older have high out-of-pocket spending. Polypharmacy is a major problem in our elderly population. There is 11.5 to 62.5% of our elderly who are taking medication inappropriately. When taking medication inappropriately, it increases the risk of adverse reactions and interactions with other medications, compliance, increased risk of cognitive impairment, impaired balance and falls, increased risk of morbidity, recurrent hospitalizations, mortality, and cognitive deficits. Agubonjimi states that inadequate or lack of health counseling on pharmacological management on most drugs is the most common reason why polypharmacy is practiced. Some of our frail elders have difficulty accessing medical services due to limited transport services and physical or financial dependence. Having one or more chronic diseases usually decreases the quality of life, and they may develop disabilities due to their chronic disease. They can start having problems managing money, shopping, preparing meals, and or taking medications as prescribed. Also, as functional ability further declines, people may lose the ability to perform basic activities of daily living, such as taking care of personal hygiene, feeding themselves, getting dressed, etc. Keeping active, eating healthier, continuing their health screens, and being smoke-free will decrease the risk of comorbidities. Healthcare providers should get involved with the elderly's care and provide them with resources to assist the needs they may have. They may refer to case management, who will inform them of any groups or associations that can help them with meals, transportation, financial and medical assistance, housing, and assist with managing their chronic medical conditions. Case management and or the physician can refer the person to home health if needed.